And can I first of all thank the Social Democrats and Dr. Shortall for bringing forward this important motion this morning. Obviously, Sinn Féin will be supporting this motion, and we will continue to advocate for the removal of hospital inpatient charges, car parking charges and other taxes on being sick on a phased basis, balancing medical and financial need. My party, Minister, believes in a single-tier universal healthcare system which delivers care where and when it is needed on the basis of need and not on the ability to pay. I'll deal with the substantial issues raised in this motion in one moment, but I think it is important for us to reflect in the wider context of where we are in our healthcare system and fundamental promises that were made by the political system of which we all signed up in the form of Sláintecare. We have not at all addressed the issues of reducing the cost of healthcare to any great satisfaction. We have not moved in any great regard on delivering universal primary care, starting with universal GP care. It's moving at a snail's pace, and even what was provided in the budget for 6- and 7-year-olds is still not in place because of ongoing talks with the IMO and GPs. We have a real crisis in GP capacity, and there are lots of issues which need to be sorted that the government haven't even started on, which is looking at demographics and demand and so on in the context of capacity. We haven't moved on decoupling private medicine from public hospitals, and we haven't moved substantially on waiting lists. We're seeing them go up. So despite the big promise that was made for all patients, including cancer patients, that we would deliver a better healthcare system, and I know we have of course been through a pandemic over the last number of years, we have not made the strides forward that we need to make, and that's not even to get into issues like regionalisation and other issues which are important to the delivery of the reforms which are necessary. From my perspective, Minister, no patient, but especially someone with a terminal cancer diagnosis, should be hounded, threatened and terrified by debt collectors. I am sure that you and other colleagues in this House have seen some of the letters that got sent to patients by debt collectors. They are nothing short of intimidation and put additional stress on patients who may already have financial difficulties and who are already dealing with the stress of cancer. And the HSE spends nearly £4.5 million on debt collectors every year. And that sounds like the furthest thing from a health system which is supposed to be moving to a universal healthcare model. We have to end this practice, particularly for those patients with cancer and chronic conditions. A cancer diagnosis is a life-altering event. Nearly 1 in 2 people will develop cancer during their life. The rate of cancer is equivalent to someone being diagnosed in this state every 3 minutes. Every year, someone dies from cancer. Cancers are the leading cause of death, with nearly 1 in 3 deaths linked to cancer each year. Cancer is therefore a massive burden on the individual and their family, and also on the wider community and society. It is something we experience collectively, and something we all experience either personally or through someone we love. As the Minister knows, a cancer diagnosis can be devastating physically, mentally and emotionally, but also financially for the person who has cancer, but also for the wider family as well. Thousands of cancer patients face into a financial burden in the region of €700 to €800 a month, nearly €10,000 a year. At the same time, many are left out of work or on reduced hours. The average household can lose out on €18,000 a year, which can absolutely devastate any household at the wrong moment, and obviously low-income households are particularly vulnerable. If you take any family dealing with a cancer diagnosis and the additional stress of its associated financial costs, how could you justify setting a debt collector on them and tolerate the sending of threatening letters in an attempt to recoup a small amount of money, at most a couple of €100, from a family which is already struggling with so much? Given its prevalence and potential severity, it is only right that beating cancer and supporting people with cancer is a top priority for us individually, for the political system and for the wider health system. I appreciate as well that in recent years, in the last couple of budgets, additional funding was made available for the National Cancer Strategy, and I commended the Minister for Health in putting forward additional spend, but there are still a lot of the key performance indicators in that National Cancer Strategy that have not been met, which have not been implemented, and will require further resourcing and support over the next number of years. So there is a lot more work to do, particularly to catch up on the pandemic backlog and the cancers missed over the last 2 years, and in delivering top-class cancer treatments which are available to private patients in this state, but also to public patients through a model similar to Britain, the National Health Service. Unfortunately, in this state, while cancer services, thanks to the efforts of the medical and healthcare professionals in that field, remain one of the better performing parts of the healthcare service, there is still, as I said, a lot of progress to be made. In particular, access to innovative new treatments must be expanded, as well as access to therapeutic clinical trials. The cancer strategy set a target of 6% on clinical trials, yet still only around 3% of cancer patients have access to such trials. In a recent meeting I had with the Working Group for an All-Ireland Cancer Research Institute, cancer researchers stressed the need to reach and beat that target. Medics want it, patients want it, research needs it. In England, and I was told by this group that up to 1 in 5 cancer patients have access to clinical trials. Access to all clinical trials. Denmark provides access to nearly 3 times more than we do. For all patients, but particularly those with severe and complex cancers, we must do better at attracting clinical trials and enabling patients to access them. This is something that can be done on an all-Ireland basis to maximise access and trial availability. It is something which patient advocates on both sides of the border have been calling for. Wealth should not determine a cancer outcome, or any health outcome for that matter, but as we know, it does. Despite the investments under the cancer strategy to date, access to life-changing treatment for some severe cancers remains restricted and only accessible to private patients. A public patient seeking access to immunotherapy to prevent the recurrence of melanoma, as an example, with the same condition as a private patient, faces a constrained system where the first option is often restricted to watch and wait. We have a huge problem as well in the public system with diagnostics, and I certainly would want to see, rather than more outsourcing and giving more money to private sector to do more diagnostics, we need more investment in community diagnostics to properly equip GPs to be able to access diagnostics more. We have got into a habit, because of maybe the ideology of the parties in government, of outsourcing everything, outsourcing diagnostics, outsourcing treatment to the private sector, outsourcing the hiring of staff, rather than properly investing in the public system, which we need to do. So again, I thank my colleagues in the Social Democrats for tabling this motion and for again putting the very important issue of cancer on the political agenda. Thank you.